Hello, we are students from Montgomery County Community College Dental Hygiene Program, and we would like to educate our future nurses about the importance of providing oral health care to patients. Much like bathing, toileting, feeding, oral care is an essential part of caring for those who are limited in the ability to care for themselves. However, access to oral care is severely lacking for disabled individuals and older adults. For example, a study from 2017 assessed the oral status of elderly patients newly admitted to a nursing home from admission until death. In the population with their own teeth, 72% exemplified poor oral hygiene, 70% had cavities, and 62% had broken teeth. Oral health is an ongoing concern because tissues of the mouth are more susceptible to bacterial overgrowth due to the environment of the oral cavity. While some of the bacteria is normal flora, proper brushing and flossing habits can keep pathogenic bacteria under control. The body also has its own natural defenses to control the bacterial load, but some systemic diseases can affect the body's immunity. This makes the disabled and the elderly more at risk to bacterial infections that cause tooth decay and gum disease. If disrupted, the bacteria in the mouth can also enter the bloodstream. A bacterium in the blood can cause health complications for those with diabetes, cardiac conditions, and other systemic diseases. Along with the concern of a bacterium, many patients you see will be affected by a variety of systemic diseases that require a cocktail of prescription medications. Many of the most prescribed medications, including those for common ailments such as pain, anxiety, and hypertension, can reduce salivary flow. A reduced salivary flow results in dry mouth or xerostomia. Saliva acts as a protective layer for your teeth, so the lack of it creates a favorable environment for the growth of bacteria, thus an increased risk for tooth decay and gum disease. In addition, medications may cause oral candidiasis, which is a type of yeast infection. Now that you know why oral health is important, you can educate and assist your patients in proper oral hygiene as future nurses. So where should you start? To begin, it is important to be able to recognize a diseased mouth versus a healthy mouth. A healthy mouth will be pink and moist without the presence of lesions, discolorations, fractured teeth, or tooth decay. Some indicators of oral disease include difficulty speaking, inflammation, bleeding, and tooth decay, which would appear as black or brown areas on the tooth surface. Unusual pathology can also be an indicator of oral disease. Any white or red lesions that are visible on the lips, tongue, cheeks, throat, or palate should be referred for a biopsy. To promote a healthy mouth, toothbrushing should ideally be done 2 times a day, once in the morning and once at night. All surfaces of the teeth should be brushed, including the biting surfaces, the back of the teeth, and near the gum line. Fluoride toothpaste should be used to prevent tooth decay, and if possible, flossing should be done daily with brushing. We are going to demonstrate how to assist an independent patient with their oral care. Whenever providing any type of care, it is important to involve the patient at a level they feel comfortable. If a patient needs more assistance, it is important to explain the procedure beforehand. If they can brush on their own, remain available for help and guidance. Have the patient show you how they brush, keeping in mind that all surfaces should be cleaned. To assist an independent patient with their oral care, you will need the following supplies: gloves, mask, safety glasses, light tongue depressor to inspect the oral cavity, toothbrush with soft bristles, and fluoride toothpaste, glass of water, floss holder or plackers, antimicrobial mouth rinse, Biotene mouth rinse, tissues or a hand towel, and lip moisturizer. Start by washing your hands thoroughly and then put on a mask, safety glasses, and gloves. Personal protective equipment, PPE, is a must, especially in a hospital or long-term care setting where there are immunocompromised patients who are at high risk for communicable disease. Place the supplies where they are easily accessible for you. Items should be labeled with the patient's name and room number to prevent cross-contamination. Use the light and a tongue depressor to briefly inspect the patient's oral cavity for any signs of a disease. Wet the toothbrush and apply a pea-sized amount of toothpaste to limit excessive foaming. All surfaces of the teeth should be brushed for at least 2 minutes. After brushing, patients should be encouraged to floss. Flossing can be aided by the help of plackers or a floss holder for those who are limited dexterity. For those that are able, patients should be encouraged to rinse with an antimicrobial mouthwash for 30 seconds. An oral rinse such as Biotene may also be used for patients who experience dry mouth. Modified toothbrushes with wider handles are available for patients who may have trouble holding a toothbrush. A standard toothbrush can also be modified with a rubber handle. When providing oral care for patients who are more dependent, always tell them what you are doing before you provide oral care. Let them know what you are about to do is going to help them be healthier and make their mouth feel clean. To aid a dependent patient in a wheelchair, start by washing your hands and then put on gloves, safety glasses, and a mask. Place all items where they are accessible. Use the light and tongue depressor to inspect the oral cavity. Wet the toothbrush and put a small amount of toothpaste on the brush. Standing in front of the patient, use your thumb and forefinger to open their mouth and retract the cheek. Never put your fingers between biting surfaces of the teeth to avoid injury. Brush all the tooth surfaces and gently massage the gums. Allow the patient to rinse out with water or spit in a pan, basin, or towel. If the patient is cooperative, you can use plackers or a floss holder to floss between the teeth. Similar care is required for a patient who is bedridden. Make sure the patient is sitting upright in bed to complete oral care. Use a light and tongue depressor to briefly inspect the oral cavity for any signs of disease. After explaining the process, turn the patient's head slightly to the side, using the thumb and forefinger to gently retract the cheek. Brush all surfaces of the teeth for 2 minutes. After brushing, rinse with an oral irrigator. Suction may also be used to remove excess liquid if necessary. If the patient is cooperative, you can floss with plackers or a floss holder. Patients who are able can also rinse with mouthwash. For those that are not able, a tooth that dipped in antimicrobial rinse can be used to swab the patient's teeth and tongue. When providing oral care, patients may become agitated. It is best to pause until they have calmed down, then resume with encouragement and praise. Always be aware that patients who are severely disabled or have difficulty swallowing can aspirate bacteria into their lungs. This can result in aspiration pneumonia, a potentially fatal disease. Caution should always be taken to use the absolute minimum amount of liquid. All liquids used should be quickly removed from the mouth using suction or an oral irrigator to prevent the risk of aspiration. Patients on ventilators may need additional oral care 2 or more times daily. Moisturizing solutions like Biotene should be applied to the oral mucosa with a toothette. A moisturizer should also be applied to the lips every 2 to 4 hours. After assisting the patient with their oral care, discard used disposable items. Disinfect and store reusable items in a container labeled with the patient's name and room number. Thoroughly rinse the toothbrush and air dry in a clean area. Document the services you provided in the patient's chart. If there are any problems, document these as well and alert the head nurse in charge. It is likely that you have patients who have a full or partial denture, so it is important you know how to help care for the patient's mouth and their denture. It is recommended that dentures be removed for at least 8 hours every day, usually at night, to allow for normal blood circulation in the soft tissue or bone. Dentures can be soaked in a container with water and denture cleaner when not in use. Hot water should never be used when soaking a denture. The heat can cause it to warp, which can result in a poor fitting appliance and gum irritation. Always use a cleaning agent that is specifically made for dentures, such as Polident or Efferdent. Toothpaste should be avoided to clean the denture as it can cause microscopic scratches where bacteria can grow. Do not allow dentures to air dry as it can cause cracking. To check the denture, simply ask the patient how it fits or notice if the denture moves when they talk or eat. The mouth can also be checked for any signs of infection or irritation. Signs of irritation could include redness, lacerations, extra folds of gum tissue, or white patches on areas where the denture normally sits. Document if the dentures do not fit correctly or if the patient is not using them daily. If the dentures do not fit correctly, it may be necessary to have the denture refitted by a dentist, so notify the head nurse. It is important that dentures stay clean to prevent bacterial growth, lesions, and infection. To clean dentures, you will need a mask, safety glasses, and gloves. You will also need a denture brush with soft bristles, denture cup, denture cleaner, antimicrobial mouth rinse, toothette, and paper towels or hand towels. To begin, remove the denture from the container and dispose of the old cleaning solution. Rinse the denture thoroughly. Place a paper towel at the base of the sink and fill the bottom of the sink with water. This will prevent breakage if the denture slips out of your hands. Gently brush all surfaces of the denture to remove any stain or buildup. Use a toothette dipped in antimicrobial mouth rinse to swab all areas of the patient's gum tissue covered by the denture, and rinse the denture thoroughly with water and have the patient place it back in their mouth immediately. As you know, there are many barriers to providing oral care in hospital and nursing home settings. Some of these barriers include obtaining proper supplies, limited oral health education, and patient resistance to care. There are solutions, though, that can help overcome these obstacles. Perhaps most importantly, nurses can and should push for oral health care supplies. According to the Nursing Home Reform Act of 1987, facilities are required to provide quality healthcare services to their residents that include day-to-day preventative care such as brushing, flossing, and rinsing. The barrier of limited oral health knowledge can also easily be overcome. Hands-on training and educational programs ensure that healthcare workers can provide adequate oral care to this vulnerable population. Finally, patients may resist your attempts to provide oral care. Although the solution to this barrier varies by patients, there are many strategies that have proven effective. Some of these strategies include starting out with a short routine and gradually increasing it over time, allowing patients to be as independent as possible, and using modified toothbrushes or flossers so that patients are more comfortable using these items. In hospitals and nursing home settings, nurses are the first line of defense that these patients have in receiving much-needed oral care. We hope that this information has inspired our future nurses to be advocates and educators for their patients' oral health.